You have been great in getting out the information that is so important to get out to our viewing, listening, and reading public, and Commissioner Helen Carlton-Harris and I appreciate that. I'm going to take my mask off for right now. Before I bring Commissioner Helen Carlton-Harris up, and I really want to give her a gratitude of thanks to her and her team and my cabinet heads down the rank and file have been tested and true, but especially Helen, who has been the point person. This has been a surreal ordeal, 20 months. If you remember, not too long ago, 20 months ago, we thought this would be over in 3 weeks. It's been 20 months, and I want to thank Helen, and I really want to give her a round of applause for steadfast leadership. She has really been looked upon in the state in Western Mass as a vocal point on this COVID-19, and very lucky and happy to have her here. I also want to thank each and every one of you, the residents of the city of Springfield and the business community, and all the health providers for what you've continued to do and your patience and your understanding. As Commissioner Carlton-Harris and I had indicated some months ago, when we were seeing an erratic uptick of COVID-19 infections going on, they were numbering $150, 150 or so a day, which rivaled the early versions of this COVID-19 pandemic. We knew we had to be proactive again and institute public health criteria for the good of all. And we did say that once we met that objective, that goal, we would relook at the mask mandate, which sunsets November 1st. In turn, the last couple of days, by the way, Monday, I believe we had 11 reported infections, which is, one too many, but very, very good. We've had 5 successive weeks of declines, good, significant decrease in declines in the infection rates. Yesterday, I believe there was 15. So at this point in time, though Commissioner Carlton and Harris do reserve the right, and we hope, I'm knocking on wood, that doesn't occur, if there was going to be another uptick, we do reserve the right to go back to mandating the mask. But as of right now, November 1st, we will honor that deadline, and the mask mandate will go away when it pertains to the public. I want people to understand and realize, though, that some individuals feel much more comfortable in wearing a mask. Please do not ostracize them. There are reasons why that they feel comfortable wearing a mask, and don't ostracize them. That's extremely important. The other thing is that some surrounding communities also, some which did not put any mask dates in effect, some which have, but have lifted those. We wanted to make sure also that there possible any type of economic disadvantage or competitive spirit would not hurt the city of Springfield's businesses also. But we're basing it, as we have, on the statistics and in public health, what's is best for public health. Schools will continue to be masked. And I think Helen will get into that. It makes perfect sense. We have still not upped the vaccination rates there. Pfizer and Moderna, the CDC, I believe, are close to okaying shots from 5 years old up. And I think that's important. So it makes perfect sense there to continue. And DESE, Commissioner Riley did put that forth with Education Secretary Pizer, the board chair on. So with Superintendent Warwick, makes perfect sense to continue that added health protection with our schools. The other thing that Helen and I want to put across to you is for the people who have been vaccinated, and we moved up the rate a bit. That's 2 goals we had, was to knock down the infections and one, to move up the vaccination rate, which we have, and I want to thank the Vax Force and the Youth Vax Force. We still need to do more. So the individuals that have gotten vaccinated, thank you. Now it's extremely important that the booster shots have been okayed. As soon as we get the booster shots, you can start getting them already. You need to get the booster shots. For those who have not gotten vaccinated, it is paramount that we double down and redouble our efforts that you get vaccinated, so we can completely eradicate or get rid of this COVID-19 pandemic. The other thing I'd like to say too, and Helen at times will say sometimes people forget about this, flu shots. Get your flu shots. The flu was almost unidentifiable across the country last year. It's important that you continue to get your flu shots, and for those age appropriate, single shots, your shingles shots are appropriate on that. So again, before I turn it over to Commissioner Helen Carlton-Harris, I thank the residents and business community, Helen, my cabinet heads down the rank and file, tested and true through a number of natural man-made disasters. We had an objective. We reached that goal. We reached that mark, that objective of knocking down the infection rates 5 successive weeks and really knocking it down, and also increasing the vaccination rate. The battle or war is not done. We have to continue to do that. So as of right now, we will honor the sunset clause of the November 1st mask mandate, which will go by the wayside, but please do not ostracize anybody that feels much more comfortable in wearing a mask on that. As I bring up Commissioner Helen Carlton-Harris, Helen and I do reserve the right, and I'm knocking on wood, if there was an uptick again, we do reserve the right to put mandates in effect. Without further ado, the Health and Human Services Commissioner of the City of Springfield, Helen Carlton-Harris.
Good morning, and Mayor, thank you again for your support as we move towards another significant milestone in the City of Springfield. When the Mayor and I put the mask mandate in place on September the 13th, that week there were 886 cases in the City of Springfield. That meant we needed to take immediate action, and we did that. We put a mask mandate in place, and we told you at that time, when the numbers decreased, we would reconsider the mask mandate. That is where we are right now. As the Mayor has suggested, the mask mandate will sunset. However, it is important to understand that the virus is still circulating. The virus is still circulating, and it's looking for hosts. We are the host for the COVID-19 virus, and getting vaccinated starves the virus. It makes you no longer a host for severe disease and death. So the mask mandate is now, for public health, a mask recommendation. And what does that mean? As the Mayor said, there are going to be individuals who will continue, like me, to wear their face coverings in certain settings. It is important to know your environment, know where you are. If you are in a large gathering with individuals that you do not know, it is important that you consider keeping on a face covering to keep yourself healthy. I think the other statistical point that's important in this decision is that the majority of the cases that we have in the City of Springfield are under the age of 30. And that means that younger individuals are taking risks and having a positive COVID test. The other statistic that's critical is last week, amongst those 554 cases, 71 were 0 to 10, and they cannot be vaccinated. We have consistently seen the data tell us that individuals under the age of 30 and our data for 0 to 10-year-olds who do not right now have a vaccination make up a good majority of our cases. So it makes sense that Commissioner Riley leaves the mask mandate in place for schools because many of the individuals in our schools are not eligible to be vaccinated based on our data. It is important, as the mayor said, flu shots are critical. There are boosters available right now at STCC with a company named Cataldo, who is sponsored by DPH. Curative is doing vaccinations at Eastfield Mall. CVS, Walgreens are doing vaccinations, as well as Big Y. So you can get your booster now if you would like. The city has not received our allotment of vaccine for boosters, but we expect that shortly. And so we will be offering boosters as well. We are at a time that I understand the fatigue. I think all of us are feeling it. I believe masks or face coverings are going to be with us for the foreseeable future in certain situations where individuals are in large gatherings and are with individuals that they do not know. The other point is the holiday season is amongst us, right around the corner. And there will be gatherings indoors with family and friends. Again, remember that the virus is still circulating, and it is important that you protect yourself and your children. A good number of those 71 children who got COVID-19 last week came from households where parents were not vaccinated. Although our vaccinated rate has slowly crept up, it's at 51% fully vaccinated. It is at 57% with one dose. And so we're making strides, but it is slow. And like the mayor has indicated, we are encouraging our residents to please consider getting vaccinated and making sure that you continue to do those public health interventions we've been talking about for almost 2 years. Wash your hands, watch your distance, and when you're not comfortable, wear a mask. When you go into that grocery store, think about it. When you go into a big box store, think about it. Think about your environment. Think about where you are. Please protect yourselves and your families. That is what this mask mandate was about. It has now been downgraded to a mask recommendation from public health standards, and I encourage all of our citizens to adhere to the basic public health guidance we have given you for over a year and a half, almost 2 years. Thank you.
Thank you, Helen. Thank you, Commissioner Falcon-Harris. I don't know if there's any questions or comments at all. Harris?
Will it start? Will return the recommendation on November 1st, and we'll have it for the rest of the weekend?
November 1st, we're going to stick to our deadline, and I'll tell you, Helen and I discussed this too. We still, Halloween's going to go forward, and that's great. I look forward to the kids coming to my doorway every year. But you're going to different houses now. And what did Commissioner Falcon-Harris indicate? Where these younger people are getting the infection now is right from their own household. Their parents or guardians are not getting the vaccination shot. So you should think about that. You want your kids to be okay. So November 1st is what we said. So, once the clock ticks, midnight of October 31st, then the mask mandate goes away. There's still a strong recommendation that you should use your head if you feel much more comfortable wearing a mask. Wear a mask, and maybe some businesses might continue it. I don't know, but it sticks to the November 1st sunset date. Any other questions or comments? Good. Okay. Thank Eric. You're right.
Businesses. If a business says you got to come in, they want you to wear a mask, or you're required to wear a
that's their prerogative. That is their business. And if they decide that they want that done, that is their prerogative on it. I want to thank the businesses. Again, we tried to, Helen and I always tried to educate first. We left last for any type of enforcement if it was egregious, which we didn't have many, but if a business feels that they want to continue that masking, that is their call. We're not mandating it now, and Helen was out and about with her team checking places on it. But we reached our objective goal and mark of increasing vaccinations, though, as Helen indicates, it's got to be increased much more. But we really decreased the infections, where we were going up $150, 150 something a day back in September, down to 11, 15 now. But the battle and the war is not over. So you got to get vaccinated and get those flu shots that are age appropriate, the shingles shots. Boosters are out there now. As soon as we get our allocation, Helen's been great. We'll continue to do our neighborhood outreaches and event outreaches to get shots out there. She's already doing the flu shots on it, so that's where we stand. Anything else? Paul?
Was anybody cited or fined for not adhering to the mask mandate?
Not off the, I'll let Helen go. Not off the.
My department did not give out any fines, and I'm sure that the police department did not either, but that would be, yeah.
But I mean, when visits had to be made, they were made, and those businesses understood what the protocols were. And again, our criteria is always to educate first, and unless it was egregious, to enforce or fine at that point in time.
Mayor, if I may,
Yeah,
just another recommendation I want to just put out there, and it is a recommendation for establishments that handle food. I would very much appreciate their continuing to ask their employees to wear a face covering or mask. Those are the restaurants, anywhere that food is prepared. That would be our recommendation as well.
Thank you, Commissioner, for bringing up a good point. I believe many food establishments are going to continue that practice on their own on that. So that's where we stand on that. Any other questions? Yes, Karen?
You had mentioned the goal of vaccinating out to September to increase vaccination. Do you know any numbers off the top of your head since now standing out to September to this day, how the vaccination?
Well, we're above the 50 percentile mark, nearly 58% on the first shot, above on fully. We were hovering, Helen can speak, I think we were hovering at 30, I don't know, it was 38%.
38, 39%.
So we did lift it by 12, 13, 14%, but we still have to do more. But the big thing was that and the combination of, again, it's that week of September, we were getting 154, 158 daily. Those rival the numbers of early on in COVID. And that's why we had to make these public health mandates. So now, as again, yesterday was 15. Monday was 11, I believe. We're still not done yet. So the two things people have to do is get vaccinated. The people who have been vaccinated, thank you. Get your booster shots, flu shots, shingle shots were age appropriate. And then just continue to practice the public health recommendations that Commissioner Helen Carlton-Harris has mentioned. About washing your hands. Where you don't feel comfortable, wear that mask. Yeah. Don't ostracize anybody that's wearing a mask. And then we can fully knock out this COVID-19 pandemic.
Common sense and good judgment should prevail. That is the message. Common sense and good judgment. Know your environment, understand your risk. Individuals that have immune compromised positions as far as their health is concerned, you need to consider keeping that face covering on. People over the age of 65, anyone who, again, their immune system is compromised, Think about your own health. Talk to your doctor. Make sure that you have credible advice. But there will be those who should continue, based on status, to wear a mask or face covering.
And again, the Commissioner, Colton Harris, Board of Health, and myself, knock on wood, we do reserve the right. We hope we don't have to do it. We do reserve the right, if there is an uptick again, to put forced mandates in. We don't want to do it, but we're always going to err on the side of caution and public health, medical, and science facts on it. So it's another hurdle we've jumped right now. Let's keep being able to jump those hurdles.
Thank you.
Thank you so much, everybody. Thank you. Thanks, man.